Hello, my name is Angela, and this is my PowerPoint presentation on systemic lupus erythematosis, also known as SLE. In this PowerPoint, we will be going over the facts, history, signs and symptoms, groups that are affected by SLE, irritants that cause flare-ups, staying healthy, diets, treatments, and prognosis. SLE is an autoimmune inflammatory disease that affects the skin, internal organs, and the joints. The history of SLE started in 1851 when it was first applied as a skin disorder. By 1941, it was named an autoimmune disease. Signs and symptoms of SLE include the characteristic butterfly rash, which covers the bridge of the nose, the cheeks, and over the eyes in the shape of a butterfly. Painful and swollen joints, hair loss, tingling and discoloration of the fingers, edema, headaches, blood clotting effects, and severe fatigue. These are related to fibromyalgia, rheumatoid arthritis, and scleroderma. Groups that are affected by SLE overall are women of African American descent, Asians, Polynesians, and Latinos. Irritants that cause SLE flare-ups are overexposure to sunlight, Tylenol, ibuprofen, aspirin, and other over-the-counter medications, prescribed medications such as birth control pills. You can stay healthy by exercising regularly and seeing your doctor on a regular basis, taking your medications as prescribed, limiting your exposure to the sunlight, doing all that you can to lessen your stress, and joining a lupus support group. There really isn't a special diet for SLE, but you would want to partake of all 5 of the food groups and definitely increase your potassium and proteins. There's no known cure for SLE, and complete remission is rare. Although antimalarials, medications that treat malaria, have been effective in treating SLE. Sunscreens and corticosteroids are used to treat lesions. There's a Chinese herbal remedy called TWHF, which is effective in treating inflammatory arthritis and autoimmune disease. Before taking dietary supplements, you should see your doctor and make sure that those are okay. Prognosis of SLE depends on the organs that are affected, whether or not you have health care and can afford to doctor visits and medication. Depends on the doctor that is treating you, because every doctor has their own philosophy on how SLE should be treated. And whether you have other health Complications such as if you are a diabetic, if you have high blood pressure, or if you have severe anemia. In closing, if you are diagnosed with SLE, don't panic. Stress can cause flare-ups. Instead, work closely with your doctor to maintain treatment regimens. Incorporate a healthy diet that is high in potassium and proteins. Exercise regularly and avoid irritants like excessive sunlight.